Hello, my name is Brandon McDonald. I'm a physician assistant student from the University of Pittsburgh. I'm here to perform a cardiovascular exam on you today. Is that okay?
Yes.
All right, before we get started, could you confirm your name and date of birth for me?
Yeah, Ben Stupé, June 23rd, 1997.
Great, thank you. So I am dressed professionally. I would have a name tag on if I had one. I've performed hand hygiene, and Ben is on a bed right now, but if he was on an exam table, I'd make sure he had a clean piece of paper. So the patient is supine. I'm standing on the patient's right side. He's clothed for this exam, and I'll keep him clothed, but in real life, I would normally expose the areas that I was examining. We'll start by inspecting his chest and epigastrium for apical impulses, for precordial movement, and for any deformities. Next, move on to palpation. I'll palpate for thrills using the MCP joints, and I'll palpate for pulsations using the finger pads. All right, we'll start with the aortic area, the second right intercostal space peristernal for thrills and for pulsations. Moving to the pulmonary area, second left intercostal space peristernal for thrills and for pulsations. Moving to the right ventricle area and the third, fourth, and fifth left intercostal space peristernal for thrills and for pulsations. Then moving to the left ventricle area, which is the fifth left intercostal space mid-clavicular line for thrills and for pulsations. And then moving into the epigastrium for thrills and then for pulsations, both superficial and deep. Next, we move into auscultation. I'll start with the diaphragm, and I will auscultate the carotids for bruits on both sides. Thank you. Good. Now, still using the diaphragm, we're going to auscultate different areas on the chest while palpating the carotids. So we're going to start with the aortic valve and the right second intercostal space peristernal while palpating the carotids. Good. Moving into the pulmonic valve area, second left intercostal space peristernal. Now moving into the Erb's point, which is the third left intercostal space peristernal. Could you take a deep breath for me and hold it? Good, thank you. And now moving into the tricuspid area, which is the fourth left intercostal space peristernal. Moving into the mitral valve area, which is the fifth left intercostal space in the mid-clavicular line. Good, and now moving into the left axillary area, which is the third left intercostal space, mid-axillary. Good, and I'll do the same thing, auscultating the same areas using the bell. Still all palpating the carotids. Good, again starting with the aortic valve area, second right intercostal space peristernal, pulmonic valve, second left intercostal space peristernal, Erb's point, third left intercostal space peristernal. Could you take a deep breath for me and hold it? Good, thank you. Moving into the tricuspid area, fourth left intercostal space peristernal. Then going to the mitral valve area, fifth left intercostal space in the mid-clavicular line. And then going into the left axillary area, third left intercostal space, mid-axillary line. While auscultating, I am assessing for heart rate and rhythm, and then for any rubs, gallops, and murmurs. If a murmur's present, I'm listening for intensity, for shape, pitch, quality, timing, location, radiation, position, and grade. Now we'll move on to the vascular portion of the exam. I'll start by inspecting his arms, his hands, his fingers, and his fingernails, then his legs, his feet, his toes, and his toenails, inspecting for size, for symmetry, for skin texture, for color, edema, vascular pattern, hair distribution, and any ulcers or wounds. Next, I would palpate all four extremities for texture and for temperature. Good. I would do that on both arms and both legs. And then I would palpate both lower extremity, his calves for calf tenderness. Good. Do that on both sides as well. Good. And we'll move on to auscultation again. Auscultation for bruits. I would do his carotids. I've already done this before on both sides. So I'm going to start with his abdominal aorta. Good. Abdominal aorta, renal arteries, good. Iliac arteries, femoral arteries. Good. Next, I will palpate for pulses bilaterally, starting with the carotids. I've already done this, doing one at a time. Good. And then I'll just do this on one side for the purpose of the video, but I would do it bilaterally, then going to brachial, the inside of his arm, and then radial, and then ulnar, and then femoral, and then popliteal, and then dorsalis pedis, posterior tib. Next, I will palpate for any edema. So could you bend your knees and put your feet on the table? Good. I'll do this bilaterally, but just for the video, I'll do it on one side, pressing it firmly into the dorsum of the feet, into the anterior surface of the ankle, and into the distal tibia, and then into the proximal tibia. So that's concluded the exam. Thank you very much for your time. I would make sure the patient is appropriately dressed. I will perform hand hygiene, make sure the room is clean, and then leave the room. Thank you.